As hospitals across Europe continue to battle the coronavirus pandemic, in what is proving to be a difficult winter for the continent's health services, debates also continue about the different strategies being taken by different countries, particularly in Spain and Sweden.
The pandemic is at different levels in different parts of Spain, and we are adjusting the measures to the degree of the pandemic situation in each part of Spain. And as I told you, we are very, very cautious regarding the opening of the restrictions.
You pursued a different strategy from the 26 other nations of the European Union who did lock down, and it doesn't seem to have worked.
I think you're wrong when you're trying to get that kind of very black and white picture of Sweden, because I'm saying it once again, that we had so many restrictions and bans in Sweden. People changed their everyday life extremely, but we didn't have that kind of lockdown.
But what next? Can and should Europe coordinate on health provisions more? MEPs in Brussels set out their plans at an S&D webinar.
We can already go a long way with the current powers that we have. It is fundamental to ensure that all citizens in the Union have the same rights to high quality healthcare and at an affordable price. We have seen that this is not always the case, and often the most vulnerable have more problems accessing medicines or certain treatments. We have those with the least economic resources on the one hand, and the elderly on the other, which are the two groups that have suffered the most from the effects of the pandemic.
What practical implications does a health union mean for people across the European Union?
The healthcare is a very important national competence. For me, as the Swedish Minister for Social Affairs, it's very important to say that the healthcare is some kind of a fundamental for our welfare system. But of course, we need to cooperate to make sure that we have this added value of the European Union. I think the question of how we're dealing with the vaccine is one very good example.
Well, it means better coordination among European member states to fight next pandemics. It means most investment in health systems across Europe, and it means better preparation to face next health pandemics or next health issues in the future. And it means to tackle one of the core issues of the welfare state that is a blueprint for the European Union.
Okay, Minister, thank you very much indeed for joining us. Thank you for your time this afternoon. Really appreciate it.
It was a pleasure. Thank you very much. Bye-bye.